biotechnology company Moderna announced it will provide the African Union with up to 110 million doses of its COVID-19 vaccine. This is in an agreement partially brokered by the U.S., which will defer delivery of some doses intended for the U.S. to facilitate the deal. Delivery of the first 15 million doses will take place in the coming months, with 35 million in the first quarter of 2022 and up to 60 million in the second quarter. For more on this, I'm joined now by public health practitioner and former African Union Youth Advisory Council member, Dr. Shakira Choonara. Dr. Shakira, good to have you with us tonight on In Focus. With the continent having vaccinated just, above 6% or so of the population, certainly an important contribution that Moderna is making to the fight against COVID-19 on the continent.
Tabo, and to your listeners as well. Of course, it is an important contribution, but if we're sitting on 5% of, the population vaccinated, we're looking at about 100 million doses. The African population is 1.3 billion, so we're still quite a number away.
And what do you think really needs to happen here as far as these big pharmaceutical companies are concerned and their contribution towards ensuring equitable supply of vaccines for the continent?
Mm-hmm. The biggest fight at the moment is whether and how vaccines can be manufactured, and really lowering, for example, the TRIPS agreement, which the South African government has been great in fighting around. And I think it's those biggest structural issues that we need to have urgent action that will boost supply, and that will really solve demand on the continent.
Yeah. Of course, these pharma companies wanting to protect their patents by all means, leaving much of the world at risk. Are we having the right kind of push and the right kind of conversation, particularly the African Union being able to lobby enough for the continent to start producing its own?
You see, a lot of it has been talk, and ultimately a lot of these huge bodies, such as the African Union, have been more on the receiving end instead of strongly pushing. What we do need to see is a range of countries standing together to try and balance the power dynamic. We're seeing South Africa, for example, we're seeing one or two other countries, but we're not seeing the bigger economic blocs. And we're not seeing the entire continent rallying behind this call. And so the call is quite weak. And rather, as I said, what we're finding is the African Union from the very early stages has been on the receiving end of PPE, now on the receiving end of vaccines, but not really and strongly pushing the agenda beyond words only.
Yeah. Many have maybe been critical of the COVAX facility, whether it has been as effective as it could have been. Strive Masiwa saying the Moderna purchase represents for the first time the 55-member AU securing vaccines not fully produced in Africa.
I think what's important to note is that the intentions of COVAX was important, and it is still important, and it was also an important mechanism and intervention at the time. But without investment, for example, of course it was going to fail. With the supply issues, of course it was going to fail. And what I think needs to happen from here is to look at the lessons from COVAX. There were very important lessons that for these upcoming doses we need to consider. What we saw in various countries is that many of the vaccines were being close to expired when they were procured through the COVAX facility, for example. Many countries running short of doses. So as we go forward, it's also, as much as COVAX was also a failure, there are very important lessons that we need to take into account as we sort of move to expand vaccine rollout.
Now, as far as the question of lifting of restrictions is concerned, and does this send the right kind of message, maybe even indicating to countries like India to lift export restrictions on vaccines, and there are very important components that are needed on the continent?
It's an important step in the right direction, but I'm not sure that, given the economics, the profit, the monopoly that exists, I don't think this is enough to unravel all of that. It's an important step, but a lot more is going to have to be done. And I think what I'm most excited about is to see the growing civil society movement in South Africa and across the continent which is really pushing the call. And what we've seen, and we know as a country coming from the AIDS response, is that it was civil society that really unraveled the power dynamics. And I think that's where our investment should go, in supporting civil society organizations to push government and push accountability.
Much appreciated. Dr. Shakira Choonara, thank you very much for coming through, public health practitioner there, of course, helping us with that conversation. Moderna now agreeing to sell to the African continent 110 million doses of the COVID-19 vaccine, an arrangement which was brokered by the White House, which will defer delivery of some of their doses intended for the United States to the facility that is here on the African continent.